The objective of this group was to prepare a guidance document for veterinary laboratories who were considering testing human samples for SARS-CoV-2 as part of a coordinated government-led response to the pandemic crisis in their country. It was initiated in March through discussions with Keith Hamilton, the head of disease preparedness and resilience at the OIE. We had discussions centered on the contribution that was being made by the Italian and Spanish veterinary laboratories, and how the OIE could encourage and support veterinary laboratories from other countries in doing something similar. So the main objective was to prepare an international guidance document for veterinary laboratories, but also it was a very good opportunity for the Standards Commission to participate in the operational work of the OIE, and also to support the One Health principle of multidisciplinary collaboration. We had experts from veterinary laboratories, public health laboratories, WHO, FAO, the Biological Standards Commission of the OIE, and the International Atomic Energy Association. We prepared the guidelines which deal with everything from regulatory affairs to quality standards, to well-being of staff, to the downstream effects for veterinary laboratories in volunteering to help with this emergency response. The guidelines were finalized internationally, and they have been distributed by the OIE to the CVOs of all the OIE member countries. They've been distributed throughout the reference laboratory network, the collaborating centres, and to the national focal points. They've been extremely well received and translated now into French, Spanish, Arabic, and Russian. They've been of assistance to veterinary laboratories all over the world. We have veterinary laboratories now testing human samples from Abu Dhabi to Argentina, from Ghana to Kyrgyzstan, all identifying infected people and indirectly contributing then, or directly contributing to saving thousands of lives by interrupting the chain of transmission of the virus. It has also helped, it's been a timely endeavor, and it has helped to increase awareness of how veterinary laboratories can contribute to a human health crisis. And there's now, I think, increased communication between public health authorities and veterinary laboratories, and a realization of our unique experience in the area of high throughput testing and our ability to scale up rapidly under pressure. Through then the network of the OIE, this group will continue to share information, innovation, and experiences to improve the laboratory systems and to improve the quality of our contribution during this pandemic. There seems at the moment to be no decrease in the testing required. So it's anticipated that veterinary laboratories will continue to test by virus detection by real-time PCR, but also that the technologies are advancing and changing, and that at some stage we will also be involved in serological surveillance when robust antibody kits are validated, and hopefully in the future a readily detectable correlative protection for this virus will be identified. And I think this will be our main focus will be on assisting with this pandemic, but also what we have learned from this pandemic is how important it is to also work on the sustainability of laboratories and on improving laboratory capacity so that small and large laboratories throughout the world are able to demonstrate flexibility in the event of crisis and to scale up for high throughput testing. And not just that they have the equipment and the qualified staff to do this, but also that they have access to essential reagents. And then I think in the broader sense for the group, it's very important that we collaborate with public health laboratories in contingency planning so that we are prepared for future pandemics like this and for natural disasters. It's only by using the One Health strategy, by pooling our resources, both our laboratory capacity and our intellectual resources, that we're going to be able to work effectively towards maintaining animal and human health and protecting our environment. We must work collectively.